Thank you, Mr. Chairman. First, let me begin by thanking you, Ms. Dean and Ms. Zayas, for being here today. I'm deeply sorry for your losses. Okay. Any death due to COVID-19 is a tragedy, and my heart is with you and the families of the 200,000 residents and staff of long-term care facilities across the country who perished during the pandemic. 3 years ago, a novel, deadly, highly transmissible airborne virus took hold. And while we knew little about COVID-19 and its long-term impacts on human health at the time, we did know that our nation's seniors were amongst our most vulnerable when it comes to suffering severe illness and death. So as COVID-19 swept the country and the federal response to the virus faltered under President Trump's states, were forced to grapple with an unfamiliar public health threat. And yes, policy missteps were made. On March 4th, 2020, the Centers for Medicare and Medicaid Services issued guidance permitting nursing homes to admit and readmit COVID-19 positive patients, but only if the nursing home could do so safely, following protocols to prevent transmissions among residents and staff. However, in an attempt to relieve hospital strain in a time of crisis, states like New York went beyond this guidance, requiring nursing homes to reopen their doors to COVID-positive patients with must-admit orders, regardless of safety and capacity to follow guidance and protocols. And as a physician, I disagree with that. Now, as COVID-19 hospitalizations and deaths have decreased exponentially thanks to the availability of vaccines and improved therapeutics, we must build better policies that will save lives and prevent harm in the event of another pandemic. As members of this select subcommittee, we must develop forward-looking policies that promote transparency in data and strengthen protections in nursing homes to mitigate current and future threats. So we do need to take a look back at our nursing homes. Where were we when the pandemic started? Where were we during the pandemic with our nursing homes preparedness? We must also look to rehabilitate nursing home systems weakened by the previous administration's efforts to roll back regulations that established guardrails for quality of care and staffing levels, leaving those facilities under-resourced and underprepared to combat a deadly virus. For example, in July 2019, 7 months before the pandemic took hold, the Trump administration's proposed deregulation of on-site infection control resulted in facilities cutting corners, assigning already overworked nurses to take on responsibilities intended for infection-controlled specialists. At the same time, the previous administration proposed loosening standards to review patient care needs, reduced consequences for nursing home regulation violators, and lifted protections for residents and families to take legal action in the event of mistreatment. What's more, the Trump administration's prolonged failure to secure adequate PPE and testing kits led to increased transmission in both nursing homes and their surrounding communities. For example, a 2021 NIH study found that nursing homes in the same communities that experienced high rates of infection saw extreme shortages in rapid COVID-19 testing. The deregulation or removal of protections of the nursing home industry coupled with shortages in COVID-19 tests and PPE were also missteps and contributed to devastatingly high rates of nursing home deaths throughout the country, as high as nearly 1 out of every 50 residents at the peak of the pandemic, according to AARP. So, when the next pandemic rolls around, we must ensure that our nation's nursing homes and long-term care facilities are fully equipped to respond to and reduce transmission of a deadly novel virus. This means identifying real solutions now that will prevent harm and save lives in the future. We cannot allow overwhelmed healthcare staff to be left behind, and we must adequately equip them with the resources they need to provide quality care and services to their patients. Under President Biden's leadership, we have taken meaningful steps towards this goal. This includes reinstating enforcement of federal nursing home standards, improving inspection, and strengthening our healthcare workforce. And let's not forget successfully and efficiently delivering life-saving vaccines to our most vulnerable populations, significantly reducing the death rate among nursing home residents. Now, there is still much more work to do. So let's make sure we're sufficiently investing in skilled nursing home staff and infection control measures, keeping in place protections, and let's hold to account those bad actors in the nursing home industry who skirted regulations and fueled the alarming death toll we experienced during the height of the pandemic. We can all agree that we can and must do better. And I'm confident that if we work together, we can identify common sense, bipartisan solutions that put people over politics, save lives, and right the wrongs that cause so much suffering in this pandemic. Thank you, and I yield back.